Debridement can sometimes be painful, and typically, it's painful when the wound is infected. And so, if you see a patient whose wound is exquisitely tender, they have a lot of inflammation, which is usually associated with infection. Infected wounds hurt really badly. So, a lot of times you can't sharp debride those because the patient can't tolerate it. Now, if we truly need to debride it, we can inject around the wound with injectable lidocaine and completely numb it where the patient doesn't feel it. If it's infected, I'm not real wild about doing that because you don't want to inject and maybe push some bacteria deep into the wound. So that's when we would use SonuWave and our UltraMist SonuWave to use that ultrasound to clean the wound and help get the infected tissue off. We would also culture it and then treat the patient with appropriate antibiotics, and that tenderness goes away. Now, when you have to do aggressive debridement to really get the wound clean, you may actually have to cut and remove some normal tissue in order to shape the wound edges properly to enhance healing. When you're actually cutting good tissue, that hurts. So we will use topical sprays, topical lidocaine, or if it's extremely painful, we will inject it where the patient feels no pain. We don't want the patient to hurt. We want their experience to be pleasant because it's something that needs to happen to heal the wound.